Good morning. Welcome. Sorry for the waiting, and thank you very much for being with us at this press conference on the humanitarian situation in Yemen and the work of the UN. We have the great pleasure to have with us Julien Harneis, the UN Resident and Humanitarian Coordinator for Yemen. As usual, Mr. Harneis will deliver some introductory remarks, and then we will have time for question and answers. And I would like also to welcome the journalists who are currently online. So, Julien, you have the floor first. Thank you.
Thank you very much, and thank you for your patience. I don't get out of Yemen much, so it took me a bit of while to find the room and such. I've just come from Aden 2 days ago, and I thought it was particularly important to meet with the media, the press, to talk about the situation there and to have an exchange with you. You are part of our world, and I really want to have a conversation. Now, the context in Yemen is very, very concerning. Humanitarian-wise, we have last year we had 19.5 million people in need, and the humanitarian response plan was only 28% financed. We are expecting things to be much worse in 2026. Why? Well, the way that economic and political decisions are playing out, the situation of the food insecurity is only getting worse across across all parts of the country, but particularly on the Tihama along the Red Sea. We're seeing that playing out into malnutrition, and the health system, which has been supported by the United Nations with the World Bank for 10 years now. We're going to see a major change there, where the health system is not going to be supported in the way it has been in the past, and that is going to have very major consequences because the government and the authorities in Sana'a do not have the capacity to support the health system, to finance the health system. And therefore, in a country which has already seen the highest rates of measles in the world, a country which has already frequently had cholera epidemics, we're going to be very vulnerable to epidemics across the country, but particularly in the north. The other element which makes our work so much more difficult in the north is the detention of 73 UN colleagues. We have had 73 colleagues, the first of whom was detained in 2021, then in 2023, then in 2024, and then twice in 2025. And with those detentions and the seizure of our offices, it has meant that the UN does not have the conditions for us to be able to work, which is, personally, I've worked twice in Yemen and in total 6 years. Before the start of the war, at the beginning of the war, and these last 2 years, and was personally part of setting up a lot of the humanitarian endeavor across the country. And to see our humanitarian response so hobbled is terrifying. I'm very worried for my colleagues, but above all, I'm very worried for what that will mean for a humanitarian response for a Yemeni population that so badly needs the assistance. Now, we are working with the broader humanitarian country team, the INGOs, national NGOs, to see how other organizations can step up, do more to cover what the UN is doing. But there are some unique capacities and that only UN agencies have, and only the UN agencies have the scale of response that is required for a country where, for example, 2,300 primary healthcare systems have been supported by UN agencies. no NGO has the capacity to support all of that. So we're going to have a very difficult time, and we will, as a humanitarian community, do our best to restructure and reorganize to be able to do that. But in the current circumstances, it's deeply challenging. And then obviously this is in a broader situation of a very constrained funding environment. So that's the sort of the overview of the challenges, and maybe we get into the questions if that's all right.
Absolutely. Thank you very much, Julien. And of course, yes, as you say, we now go to the question. I'll start, as usual, with the room. Robin is the correspondent of AFP.
Good morning. Thank you. Do you feel that with everything else that's going on in the world at the moment, we think of Gaza, Ukraine, even Greenland, that Yemen and the humanitarian situation there is being totally overlooked? And secondly, you spelled out the financial situation for 2025. For 2026, how many people are going to be in need of humanitarian aid? How many of them do you think you'll be able to reach? And what is the funding situation? How much money do you need? And how much do you think you'll be able to get? Thank you.
Thank you. Thank you. Should we take a couple more?
Yeah, we take one of
Yes, please.
We do one by one.
One by one.
Yeah,
Okay, excuse me. Sorry.
Yeah.
Sorry, I'm not very good on the press thing. Look, thanks for the question, Robin. So it really depends on which media you're looking at. I mean, in fact, you can see it today in this press conference of the online connections from the Gulf region and the broader Middle East. There's a lot of interest, and when you look at the regional media or those medias which are Arabic language media, there's a lot of coverage of what's going on in the areas under the control of the government of Yemen, and more generally under what goes in Yemen. One of the constraints is that there's very little media that goes into the areas under Sana'a. And 70% of the population is international media, I refer to, or regional media. 70% of the population is there. And in the last 2 years, I can think of maybe one or two international media that's been there. And so we as humanitarian organizations constantly speaking out about the situation. We raise it every month. The Security Council, OCHA, does a briefing on the humanitarian situation in Yemen. But the media the international media is not engaging with Yemen in the way that I think is needed. Now, obviously, on our side as well, we need to reach out more and discuss that. So yes, it's definitely a challenge. But obviously, it's not just the media. With the member states who support the humanitarian response, we are looking to increase engagement with them. A lot of the responses for many years have been funded by Western governments, I think we could describe them. But obviously they're financially under a lot of pressure, and the budgets are coming down. The Kingdom of Saudi Arabia, the Emirates, other Gulf member states have been generous. But we're hoping that an engagement with them will see greater attention to this on the humanitarian side. There's obviously a lot of political attention. So that's that's sort of the matter of attention. As I said earlier, 28% of the funding, not good. About 688 million last year was the amount received. Obviously the beginning of the year, so I don't know how things are going to play out in this year, but given the environment, I am very concerned. I've spoken to Tom Fletcher, the Emergency Relief Coordinator. Yemen is one of his priorities. It's on his list, and he's bringing that to member states. to the International Agency Standing Committee. So we're doing what we can to bring greater attention to this, but it's going to be needed. And my fear is that we won't hear about it until the mortality and the morbidity significantly increases in this next year. Thank you.
Absolutely. Thank you very much. Other questions in the room? I'm looking. John Zarokostas, France 24, and The Lancet.
Yes, good morning. I was wondering if you could bring us up to speed from the retreat. What's the message that you got from the Secretary General concerning Yemen? And what are your top 3 priorities given the limited funds coming in? Where are you going to focus? There's a risk of famine, and the situation in the health front is dire. So what are the top 3 priorities in the first 6 months for you? Thank you.
Thank you, John. So the Secretary General is personally engaged on Yemen and on the following up on the political situation in all parts of the country, on the humanitarian file, and personally involved in the matter of the detention of our colleagues. He travelled to Muscat, Oman, last month in order to engage with the Sultan to bring up the conditions and the fact that our colleagues were detained and how that was an impediment to the United Nations being able to work in the north. He is deeply concerned about the political situation, and you'll have seen his statements on that, but also the statements of Hans Grunberg, the special envoy, and obviously in tandem with the emergency relief coordinator, and given his past as head of one of the major UN humanitarian agencies, he's deeply worried about that too. So the SG is following this in detail. In terms of the priorities, it is the priorities for Yemenis firstly, then it's the priorities for the humanitarian country team. The focus has to be on public health and malnutrition, as well as food insecurity. Why? Because whilst the food insecurity situation is deeply worrying and we're expecting a degradation, it is not food insecurity that kills. Food insecurity contributes to malnutrition, but as does poor access to clean water, as does lack of access to healthcare services. And when those things are going, as does socioeconomic conditions, when those things combine together, you get malnutrition, and then that's where you see the mortality and morbidity, particularly affecting the under 5s and particularly children under the age of 2. So that's so the nutrition, public health, particularly at the primary healthcare level, and food insecurity come together and are priorities across the country.
Thank you very much. Yes, Boris?
Yes, Boris Engelson, a local freelancer. You alluded to the attitude, the lack of information conveyed by the media. In the current world, in crisis situations, there are places where we feel we understand what's going on. In Gaza, most people think, rightly or wrongly, they understand what's going on. In some other places, it's a bit, they are not sure who are the good and bad guys. But in some countries, like Yemen, most people, even informed people, don't really understand what's going on. So among 10 people you report on Yemen, or you address about Yemen, how many understand what's going on?
Well, Yemen is. I've been working in humanitarian conflicts and emergencies non-stop for 20 years. Not as long as some colleagues, but it's of time. And Yemen is without doubt the most complicated and complex humanitarian situation I've ever worked in. And I would generally say, if anybody tells you they know what's going on in Yemen, they are, I think they're bluffing. so I think 0 out of 10 people should know what's going on in Yemen, because it is it's an extraordinarily complicated situation. I've just in the last month in Aden, we went through a situation where you had the government of Yemen in charge. Then over 48 hours, the Southern Transitional Council took over the whole of the government of Yemen areas, including areas which they'd not been in for ever. And then 4 weeks later, they had announced that in Riyadh that they had dissolved. And now the government of Yemen has taken those areas. But at the same time, we've got demonstrations in Aden saying that no, we're not, we're still there. So it is and then that's just in the government of Yemen areas without looking at Sana'a. So it is an extraordinarily complex situation, and of course that's the challenge for humanitarians. The more complicated the situation, the tendency is for member states and for people who could give money is to go, no, it's just too complicated. We don't understand it, and there isn't a simple narrative, and therefore, without that simple narrative, more difficult to raise funds. The reality is, the simple narrative is, children are dying, and it's going to get worse. For 10 years, the UN and humanitarian organizations were able to improve mortality and improve morbidity. But with the conjunction that we're seeing this year, that's not going to be the case. That is the simple story that everybody needs to understand. Thank you.
Thank you very much, Julien. Let me go to the platform. We have got Nick Cumming-Bruce, the New York Times.
Yeah, good morning. Thank you for taking my question. In the last couple of years, it looked as if there might be some kind of patching up or agreement between Sana'a and Saudi Arabia. We've kind of lost sight of where that is, and I'm just wondering if you see any progress on that particular front. And secondly, you've alluded to the problems with the STC. What is the state of that sort of particular conflict? How much is that impacting on humanitarian assistance? And to what extent is there a sort of a homegrown a desire for separation in the south, or is that something that's being driven by external parties? Thank you.
Thank you very much, Nick. I'll not answer the majority of your question because it is an area of goes into the mandate of Hans Grundberg on the political side, a special envoy, which he is uniquely placed to talk about. I work on the humanitarian and the development file, so I'll sort of stick to my area of knowledge and competence. What I can say is that the parties to the conflict have not been able to find a solution is what's driving the increase from 19 million to 19.5 million to 21 million people in need this year. It's not active fighting, it's not massive displacement, it's not bombing, but it is the collapse of the economy, it is the ports which have been highly damaged in the last year. It is the fact that the airports are no longer operating. It is the disruption of essential services, health, education, etc. Of all those things which create this worsening situation. So, in the absence of political solutions, it is impossible for the humanitarians to deal with this. We We can take the edge off it. We can save lives, but we cannot stop the underlying dynamic, which is creating all these needs. In terms of the consequences of in the government of Yemen area, I mean, there are, I've travelled all over Yemen. There's many parts of Yemen that you would sort of go to, and you would think that you were in a country that had development challenges, but not a conflict. The difficulty of the political challenges which the country is going through at the moment means that instead of focusing on development, instead of governments and local authorities being able to focus on improving electricity supplies, including access to jobs, getting Yemenis employed, improving the healthcare system. Instead of that, the leaders of the country in all parties are focused on understandably, are focused on the political challenges. Although there have been announcements that they will be working, supported by member states, particularly Saudi Arabia, to address that. But obviously, it takes your eye off the ball. So the political crisis has an impact on, or the political challenges, I should say, has an immediate and direct impact on the lack of development, and therefore feeds into increased humanitarian needs unnecessarily.
Thank you very much, Julien. Yes, Robin, follow up?
Thank you. The negotiations to free UN colleagues who are being detained, do you see any glimmers of light in that process? And do you see any signs that the parties to the conflict understand the level of damage that does to the UN's ability to be able to deliver humanitarian aid in the field?
Yes, thank you. And I talk to the families a lot, as do the representatives. It's very, it's terrible for them. Some families haven't seen their loved ones in 5 years. They don't know the conditions of the detention. They don't know where they are. They don't know if they're going to be sentenced to death in the coming days. So the families are suffering, and it's more broadly, it's terrifying across all humanitarians who live in the north or work in the north, because you just don't know what's going to happen to you next, and you don't understand why. Why did this happen? We've been working in the north for 10 years. We've been working in Yemen since the 60s, but we've been working in since the beginning of the conflict. We've been there. We've been operating. We've been doing a huge contribution, and then suddenly in the last couple of years this breakdown, and inexplicably so, and so that is a terrifying effect on the humanitarian workers more generally, which in of itself is debilitating. Obviously, the detention of our colleagues comes within a broader context. There's also INGO staff who've been detained, staff working for certain embassies have been detained, activists, people engaged in politics in different ways, people from the government. Nobody talks about them. Nobody talks about them and who's paying for their salaries. So the detention is a much broader challenge across society. There are some detentions in the government of Yemen areas, but nothing of the scale of what we see in the north. So it's a challenge directly for the humanitarians, but it's more broadly a challenge for Yemeni society. that I believe from a human rights perspective merits much more attention. Now, as I noted earlier, the Secretary General's met the Sultan. He's raised this with the government of Saudi Arabia, with many of the government of Iran, with many of the member states of the region, himself personally, at all levels. Hans Grunberger has also done this. He's constantly circling around the region, and we have a colleague who's working purely on the detainee file, who is engaged. So member states understand the challenge. They express sympathy, but there are so many concerns that they find it difficult to apply the appropriate engagement to address this. And of course, the other thing is that we've seen the situation in Yemen. It's an intractable situation. If you look at what happened on the Red Sea and the other elements of the conflict, member states have attempted to put pressure on the authorities in Sana'a, and it's been very challenging. So it's a really difficult issue to resolve. We need to keep at it for many years to come, and we do need greater support from member states. Thank you.
Thank you very much, Julien. Let me see if there are other questions for you in the room. John, is that a hand? No, it's a pen, but it's a hand. Go ahead.
Yes, coming back to the link between access to clean water and disease, as you very well know, quite a few of the water facilities were bombed. How many of these have been repaired, producing clean water in urban and other areas? So what percentage of the population would be roughly having access to clean water? Thank you.
Thank you, John. The broader challenge for access to clean water is not so much physical damage caused by bombing campaigns, because the access to water in Yemen is very dispersed. You have bore wells every couple of 100 meters in certain areas. There's two challenges that Yemen faces on water, and this is particularly all of Yemen. One is with an increasing population, climate change, and a population which uses much water more water per capita than ever was done in the past. The water table in most of the areas of urban, most of the major cities is dropping. For example, in Sana'a, some bore wells go down to 1,000 meters and more. So you have a huge challenge about access to water because of those the underlying situation, nothing to do with the conflict. Now, if you've got these, it's not a country in certain parts of, in other countries where water is available at 5-10 meters below ground level, or surface water. So what that means is that you need power. You need power in order to be able to bring up the water, and that means you need diesel, or you need big solar systems, and the economic challenges, the damage to the harbour, and then obviously the pause on the fact that the UN is unable to work on increasing the availability of solar and increasing the capacity of diesel, delivering diesel in order to bring up the water is producing a massive constraint on water. So that's another huge challenge for all parts of the country, but particularly the north. We're looking as humanitarians. We're looking to see how that's going to be resolved, but it's deeply challenging. Thank you.
And we have a request for follow-up from the New York Times. Nick?
Yeah, thank you. The United States made it clear when it was producing $2 billion for Tom Fletcher the other day that Yemen was not on their list of potential beneficiaries. I'm wondering what's your sense of who are, from the discussions you've had so far on this year's appeals, who is lining up to produce support? Is that mainly going to be, for the UN system at least, from European countries? Alternatively, is the reality that the people most likely to provide funding for projects in Yemen are basically shunning the UN system and are doing it bilaterally? Thank you.
So I think, without wanting to throw flowers at Tom, the emergency relief coordinator, I think the negotiation of the $2 billion for pool funds is an extraordinary achievement, and demonstrates a trust in the UN, and demonstrates a trust in the mechanism of pool funds. So that says to me, that doesn't say shunning. You don't give $2 billion to somebody that you're shunning, or if you do, I'd like to be shunned as well. So there's clearly an engagement from member states, but at the same time, you can understand why the United States would have great difficulty in providing humanitarian funds for Yemen specifically. Obviously, there's been, last year there was an active conflict. I'm not quite sure what the appropriate designation of it is, but the Ansar Allah was firing missiles at U.S. Navy, and the U.S. Navy was firing back. And there are employees of the United States who are detained. So in those circumstances, it's extraordinary that the United States did provide as much assistance as they did. And for many years, the US was the biggest donor to the humanitarian response in Yemen. That's no longer the case. I am hoping that at least in parts of Yemen, the US government will come back to fund, and that's important because they are worldwide or have been worldwide the biggest humanitarian donor. The top three donors in Yemen in recent years have been the United States, Kingdom of Saudi Arabia, and the United Kingdom. I am hoping that we will see even more support from the Gulf countries. Yemen, a humanitarian crisis in Yemen is a risk to the Arabian Peninsula. Cholera crosses borders, measles crosses borders, polio crosses borders, and so and we've seen that in the past with particularly with cholera. So as a community worldwide, we need to provide this humanitarian support, but I'm particularly hoping that we will get great support from the Gulf member states. And I've just recently been invited to an event in Riyadh to contribute to a discussion on the global humanitarian overview, precisely because King Salman Relief was so interested in the situation of Yemen. So there is a great deal of interest there, and I think we need to work above all with those member states. Thank you.
Thank you very much, Julien. I think this... John, sorry, I didn't see you. Yeah, I can't see it very well. Go ahead.
Yeah, a final question. Coming back to the funding issue, roughly what percentage of the funds donated by member states are earmarked, and how many give you more space to work? Thank you. In other words, non-earmarked.
Well, in a highly charged, complex emergency like Yemen, the majority, most funds are directed either thematically, geographically, or there are various constraints and limitations to ensure that the money is spent in certain ways. Right? So there's very little in the way of funding provided to UN agencies or NGOs, or where you can broadly spend it as you will. Right? So I don't know if you how you precisely describe that as earmarked or not. We do have a Yemen humanitarian fund, which has been very successful. 66% of the funding goes to local NGOs, 33% goes to women-led organizations, and those funds are always allocated on the highest needs, and I think that links to the success of Tom in this allocation towards the pool fund. Pool funds are an excellent instrument precisely to deal with this, addressing the most pressing needs in any particular country. We're at the end, right?
Yes, we are.
Can I say one thing?
Of course you can.
Thank you. So I just wanted to appreciate the engagement and the importance of the press corps in engaging on this subject. We need to be looking a greater deal on what's going on in Yemen. I also want to note that some excellent work provided by local analysts and regional analysts. I won't embarrass them by giving out their name today, but there's some really solid work that's being done by those experts, but is not finding its way through to a broader public. And I really hope that together we can get through the message about the great risks to Yemenis in this coming year, and but the fact that we can do together, we can prevent an increase in mortality and morbidity, but it will be very challenging. Thank you.
Oh, thank you, Julien. I really hope our colleagues, journalists here and on the platform, which are quite numerous, will listen to your appeal. And we really invite you to continue keeping us abreast, and thank you very much for coming and speaking to the journalists on your visit in Geneva, or with your colleagues in the field, John, and others that can intervene at our press briefings from afar. So we really want to keep the Yemen dire situation on the attention of the journalists. So thank you very much to everyone for following this press conference. Thanks to Julien for coming and talking to the Geneva Press Corps. Have a nice day and a nice week. And I'll see you tomorrow for the briefing. Thank you. Merci.